Hi, good evening to everyone. Thank you for joining me. And today I'm going to focus purely on science around COVID-19. And I'll be sharing with you some general principles about the kind of research I've been doing and why I think it's important. And one of the points is about asymptomatic transmission of SARS-CoV-2. Now, a lot of people get this confused, and I'll take you through what I thought was very important about the science. I'm going to take you up through a paper that looked at early infection with the virus so that you can have a better understanding about how the science works. And that's essentially what I'll be trying to do. Before I start, I'd just like to explain to my listeners these days, social media censorship is growing rapidly. The reach is decreasing. I can tell you that even on YouTube, where probably my most significant reach was, that has gone down at like 20 times. That's humongous because people don't seem to want to know about the science because the science is inconvenient. It's not necessarily what people had hoped for, and what therefore they want to do is silence independent thinking. So, in the context of what may happen in the future, if you do want to hear me, please, just in case of the future, you can join me on Substack. That's where I tend to share lots of information. And most of the things that I'll share here, I'll break it down in some more detail on Substack. So you can always join me there. As well, the other thing that I would appreciate is MR Education, McMillan Research. This is where I have free courses, they're paid courses. Any kind of support is appreciated. I will be building this out to try and have content that's of relevance to everyone where you can go and see it, even if you are not able to reach to what it is that I am doing. And so this is an important piece of the puzzle with regards to the science around asymptomatic transmission. So let's start with a few basic things, and I'll explain to you why it is that I am focused on this at this point and what it is that I think is very important. So I have here quite a few people who are listening with me, and so I'll show you why it is that even if I'm criticized about what I speak about, I'll explain to you why I am sure of what I'm speaking of. So take a look at this here. So this is a search strategy that I used. I'd saved it a few years ago. And this was purely on the question of asymptomatic COVID. You can see here, this is 948,000 papers that it searched through, of which I concentrated down to 47 papers. That was just around the question of asymptomatic COVID. And you can see all these published papers here looking at different things about the characteristics of the infection, how the virus infects. So, this is just an example of the kind of detail that I go into and why I don't question. A lot of people don't seem to understand how much detail I went into. And in the context of looking at all these papers, I'm just highlighting one of these 47 papers just to show you what the kind of question is that I was trying to look at. So early in the pandemic, I recognized that there was a viral phase and there was an immune phase. So my question was, what happened in the viral phase? So in the first week before people started to get really unwell and ended up in hospital, what in the world was going on in their lungs? The problem is by the time we did autopsies on patients, and that means we'd look at patients who had severe COVID-19 and we did the autopsies, this was very severe inflammation. And so, therefore, at that point, you would struggle to understand what was happening in the early phases of the disease. So, let me take you through a few steps, and then I'll go back to the paper in a little bit. So, let's start with some simple points here. When the virus infects, so if somebody gets infected, it goes in through the nose here, and you can see that the virus will get inside the upper airway, primarily through the nose, and it tends to infect the olfactory region and critically what we call the nasopharyngeal region or the epipharynx. Once it gets there, it then replicates and then it can spread. Very important, this phase is stealthy. There are oftentimes no obvious symptoms. The virus can replicate every 10 hours. So if you imagine one viral particle could then become 5,000 viral particles. Those 5,000 viral particles in another 10 hours could become probably, 500,000 to a million viral particles. And so this process occurs very, very quickly. Now, what happens is that once the virus starts to replicate, it follows air, meaning that wherever you breathe. So if you breathe in, it goes down your lungs. If you breathe out, it spreads to other people. And this is where a lot of people got very, very confused about what was going on. Just because somebody had no symptoms did not mean that the virus was not spreading. So again, back to the basics of this is an example of a normal lung. So this is someone here, and this part here is the lungs. You have the trachea with the bronchi going to both sides. This is the right lung, the left lung. And these lungs are essential for oxygen exchange. This is why we breathe. We don't use most of it. And so therefore you bring oxygen in to the bloodstream and you blow off carbon dioxide. And the size of the lungs, if you were to spread out all the alveoli in the lungs, is approximately the size of half a tennis court. So it's a really big surface area. And this is how we breathe. And this is what is critical in terms of understanding COVID-19. When it then comes to the infection, what then happens is that you have infection in the upper airway. And then as you breathe in, virus then spreads down into the lungs. And once it gets into the lungs, this is an example of what we call healthy lungs here. And then this is an example of inflamed lungs. Okay. And so once it gets down into the lungs, it causes inflammation. Here's the really interesting thing. This process of inflammation is also largely asymptomatic. And this is where a lot of people get confused because the virus primarily blocks interferon. Interferon is that signaling protein or cytokine that tells your body there's infection. And that's how your immune system then kicks into action. It's one of the very early starting points of infection. So, if the virus is able to block that interferon, and that's what happens when someone has not been previously exposed to the virus, then it can spread down into the lungs without you having an immune response. That is the primary modality of how the virus causes disease. And that's why we can have such a high number of people who actually had inflammation in their lungs with no symptoms. So here's a really interesting example. This was from one of the papers that I had found. So I'd been trawling looking for answers for this question: what exactly happens in the lung? So this was what they found when they infected macaques, and they put the virus in so that they knew it would get infected in the upper airway, and then they saw what happened afterwards. This is fascinating. This is day zero, and this is just showing you normal lung. So this is the normal lung at day zero. And within 2 days, that is the extent of inflammation that they found when they looked at the scans of these animals. And they only had very mild symptoms, slight temperature. They looked a little bit more tired. So that was probably when the interferon response kicked in. Within 2 days, this is what happened. Very important to understand. So by the time the virus has spread through the lungs, there's still limited symptoms. And for some people who have good mucosal immunity, a small amount of the virus getting into the lungs with an interferon response means that it doesn't even have symptoms equivalent to a cold. That's how important interferon is in the process. So, what happens in the later phases? So, this is now where you differentiate the viral phase from the immune phase of the disease. And an important piece of that puzzle is to do with lung blood vessels. So, this is just an example again of the lungs with the alveolar sacs in here, where you have air coming in, and you have these in red are the blood vessels taking away oxygen, blue blood vessels bringing blood that needs oxygen. And this is just a breakdown of the different layers of the blood vessels as it goes all the way down to the capillaries that would then supply the alveoli. So this is a normal lung, and this is a normal situation in the blood vessels. In the immune phase of the disease, what really causes the damage in terms of breathing difficulties, sorry, I have to jump forward here, is this microclots. So, what happens in these very small blood vessels because of inflammation within the walls by the virus, by the immune system? You have these situations where this little clot here can block up one of the smaller arteries, so the blood can't get past it. And so then you have regions of the lung that don't have blood flow. This is really what causes severe disease and causes death. For those people who are non-clinical, they probably not understand this, but people can have very severe inflammation in their lungs. And if you put them on oxygen, you can manage. If they are struggling with oxygen, the majority of cases, if you put them on a ventilator with 100% oxygen, they will still survive with a normal infection, a very bad infection, because you can still get oxygen in. In the context of severe COVID 19, even patients on 100% oxygen on a ventilator would still die. That would mean that up to 90% of their lung was not functional. Really critical piece of the puzzle. And so, therefore, the inflammatory phase of the disease is primarily where you see most of the problem that leads to death. In the early phase, which is the viral phase, that part causes inflammation, but often not enough even to get a patient in hospital. They may be coughing, they may be just a little bit short of breath, but they'll be okay. Now, here is the piece of the puzzle that really a lot of people don't understand. And if you don't get this, nothing else will make sense. This is about that interferon response that I mentioned, with interferon being that signaling protein that tells your immune system that there is virus there. It's one of the first things that happens. So, when they look at someone who had an infection in their upper airway, if they had some degree of immunity, and it didn't have to be to SARS-CoV-2, it's any coronavirus, any cold virus, even, you would then end up with an early interferon response. And that means that the virus can't surprise the lung. And so you have mild inflammation. What's really interesting is in people who had, even when they had a big surge of virus, this is green here, but they had poor interferon response if they're on immunosuppression, if they had HIV, if they were just old and frail, you still had mild disease. What really caused severe disease was a combination of high viral titers and a delayed interferon response. That's what triggered that very severe part of the process called leading to severe disease. So, my question at the time was, what is it that occurs in the lung in the context of a delayed interferon response that leads or could lead to severe disease? So the closest that I found was to do with the paper that I mentioned, and I'll show you this again so that you remember here. So this is me doing my research here. As I said, just on this point of asymptomatic infection, these are all the papers that I had highlighted that were relevant in terms of understanding the pathophysiology. So this here is the paper that I've highlighted here, the clinical course of COVID pneumonia in a patient who was undergoing a pneumonectomy. Okay, what happened in this case here? So just so that you understand the situation. So a patient who had lung cancer came into hospital and he needed to have a section of his lung removed. This was an elective procedure, meaning that he was largely well, came into hospital. He then went and had his surgery done, recovered after the surgery, and then became short of breath a few days after having the surgery. At that point, they realized that he had COVID 19. So it was purely coincidental that he actually had COVID 19 before the surgery with limited symptoms. And so it gave us an opportunity to look at, well, what exactly is happening in this case? So, as I said here about the 69-year-old male, right pneumonectomy for squamous cell lung carcinoma. And so, 4 days after the operation, he was noted to have X ray changes. So this is the paper in some more detail here. This was actually published in June 2020. So this is information really critical that was published early in the pandemic, and it was actually from Turkey. This that this happened. The bit that I want to show you in this here is these are the X-rays. So this here was his first X-ray. So you can see here, this is at the beginning before he had the operation. And this one here in B is that after they remove the lobe of the lung, it then fills with fluid. And so you have this here being shown. Then they have, this is when he had COVID. This is C. See here now, you have quite an infiltrate in the lungs 4 days post-operatively. That's when they realized that he had COVID. And by D, he had recovered. So this patient didn't die. He still had a moderate episode of COVID-19, but he didn't die from COVID-19. So, my question in the context of that was what was going on in his lungs in the early phase of the disease? What was it that was happening that was so important that could have led to severe COVID 19? And so, this is now the part. So, remember, again, just before I go into this, remember that this patient had no symptoms. He came into hospital. He was preoperative. They would not have done surgery if they thought he had an infection, certainly COVID. So he came in and he was well. He has the procedure done, and when they looked at when they looked at the histology, so they then looked at the details of the lung. And so it says here microscopic examination. This is in a microscope looking at the histology, um, revealed alveolar edema, intraalveolar fibrin, and protein and fibrin exudates with irregular but marked alveolar damage in the lung away from the tumor. So, this is the COVID. This is what was happening even before he had any overt symptoms. And it went on to point out here again, in some areas, abundant alveolar macrophages, multinucleated cells, and prominent lymphocytic infiltrate were observed with type 2 pneumocyte hyperplasia. This is what was occurring in the lungs before symptoms. And that's the bit that I'm trying to get people to understand. Just because there were no symptoms didn't mean that there was no inflammation in the lungs. That's how it works. The primary strategy of the virus is stealth. It does its damage in the lung not by directly destroying lung cells, but because the immune response is so severe because the virus gets down into the lungs, that immune response drives that severe changes. So the mild part of the infection with the virus very rarely causes any kind of breathing problems. It's what happens afterwards when the immune system or the cytokine system kicks in. And a good way to think about this is the lungs are never supposed to have a virus getting to them without warning. The equivalence is, for instance, in the White House, imagine a burglar being down in the bunker. It would cause almost a national incident, bringing in the National Guard, because how would somebody have evaded all of the security to get down into the bunker? That would have caused a huge response. That is very similar to what happens in the lungs. So, this is just again taking us back to the science, helping us to understand how the science works, because it seems that, as I said, a lot of people didn't do the research. That's where I'm different. I did the work, I put in the hours. We're talking of hundreds of hours of listening to lectures, going through the research. What can I say? I just didn't expect this information to be relevant at this point. I thought COVID would be over. But here we are. We're now moving into what they call new COVID. Here is the lesson that I would say to people. If people didn't understand the first phase of the disease and they're trying to tell you what's happening now, they have absolutely no idea. So if you want to keep up to date, please keep following me. I'll tell you how the science works and I'll try and figure it out as it continues to evolve. Have a great evening.